Blog Talk Radio.
Good afternoon. This is Michael Stigl. We're a live session today with Dr. Brand, Adele Brand. I believe she's on the other line. I'm going to put her through in a second here, and we're going to have a live show today. She's a holistic dentist, and we're going to talk about what she offers. So let's see here if I can patch her in here. Just one moment here. Oh, let's see. Hello, Dr. Brand? Oh, let's see.
Hello? Hi, it's me. It's
Hi.
Dr. Brand.
Yes.
Hi, how are you?
Good. Welcome to the show. You're on the air, just so you know.
Yes, thank you.
And again, yeah. And again, I just wanted to let people know that you're a holistic dentist from New York. You've been in this practice for about 30 years. And that you also offer a few other modalities. I believe you're a hypnotherapist and a nutritionalist, and also you there's one other thing that you do too.
Oh, I do a lot of stuff. It's all good. Anything to promote health, that's what I do.
Yeah. So, okay, well, anyway, we're live. We've got the show getting ready to get it started. Let's see here. One of the reasons why we have you on the show today, there's a lot of different things that you do in your dentist practice that other dentists don't do, which, promote health. And that's one of the reasons why I think, anybody that's listening to this podcast needs to stay tuned, because we're going to go over some things that are, they're very important things that they wouldn't necessarily know if they went to the dentist. They wouldn't look for these things, and you're doing some of these great things that promote health. And so let's see here. Okay, so could you do me a favor? Could you tell us where exactly you're located if someone wanted to come to your practice?
Sure. Yeah, I'm right smack in the middle of Manhattan in New York City. We're right there on 34th Street, right down the block from Macy's at Herald Square, or opposite the Empire State Building. So we're easy to get to. All the mass transit is there. And if you want to contact us, the best way to contact us is through the website. You can go to thebrandwellnesscenter.com, or you can call us directly at our phone number, which is 212-947-0073, and that's also found on the website if you want to contact us.
Awesome. Now I've already told everybody, I guess I answered the first question. I've told everybody that you've been doing this for about 30 years. I'd like to know, can you give us a little bit of information about where you went to school?
Sure. I went to New York University College of Dentistry. I did graduate in 1981, and I was a general dentist for many of those years, but then I found holistic dentistry through my own health challenges, and that's how I got in this path. But at NYU, they teach you, the good basic dentistry that you need to know to fix teeth and to help people with their cavities and gum disease and all that kind of stuff. But we incorporate the holistic as well, and that was advanced training after dental school.
Oh, wonderful. Now, let's see here. Does your dental practice accept dental insurance?
We are a fee-for-service practice. We do not accept any insurance directly. However, if you bring in the insurance papers, we will fill them out for you and submit them electronically so that you can get reimbursed. Usually within 7 to 10 business days, everybody gets reimbursed. And I have to say the reimbursement rates are pretty good. It's not like we're overly priced or anything because we're holistic. We are very fair with our fees for a private office in Manhattan. So if you have dental insurance, certainly we can help you work with it so that you can maximize your benefits.
Oh, awesome. And so the next question I had is, can someone self-pay? Can a patient self-pay at your office?
Of course. Yes, we do accept all major credit cards, cash, personal checks with a photo ID, and we do have financing available through Care Credit. And all that information is found on the website, which is thebrandwellnesscenter.com.
Oh, wonderful, wonderful. Now, let's see here. How can someone become a patient? Say I walked into your office today and I wanted to become a new patient. How would I go about doing that?
Very easy. You can just call us at the phone number that I gave before, or you can certainly contact us through the website, and we will just set up that appointment for you and give you some forms to fill out. In the forms is your dental history and your medical history. We do go through the medical history quite comprehensively because many of our patients have a lot of health challenges that conventional medicine and conventional dentistry has not been able to solve for them, and because of our integrative approach, we are able to help many of these people to heal from many chronic illnesses, at least to detox and to feel much better through working the health of the mouth.
Oh, that's wonderful. And let's see here. I'd like to ask you, how did you know that you wanted to become a dentist? How did you get the feel for it?
You know, it's a life's journey. Everybody tries to figure out what they should do with themselves when they're growing up. Yeah. I was always into medicine. I did volunteer in many different kinds of facilities, hospitals and other medical places, and I enjoyed helping people. That was always primary. And I think what it was is that I didn't want to be a medical doctor because it was too much life and death type of stuff, and I enjoyed the creativity of the dentistry. You know, because there is a lot of arts and crafts to it, if you will. And for me, it just seemed to make sense.
Oh, that seems like a good reason. Now, let's see here. Now, how is holistic dentistry different from regular dental practice?
You know, that's a terrific question. And I'd say, how many hours do you have? Because I think yeah, if you ask different holistic dentists, they'll all have a different answer for you. But I think the basic, bottom line with a holistic dental practice is that we try to do things that are most biocompatible for the patient. We focus on whole body wellness, and we have a more comprehensive approach. We just don't go in there and fix a tooth. We look at how that tooth is affecting perhaps the rest of your body and other health. I mean, I think most people know that periodontal disease is very prevalent in people over the age of 40. I think like 80% of the population has it. And I think most people know that when you have periodontal disease, which is gum disease, you're more prone to heart attacks and strokes. I mean, that's conventional thinking. So in our practice, we diagnose things like that and give you tools to work with so that you can turn this around. So not only are you improving your gums to help your teeth stay in your mouth longer, you're also helping your whole body health so you won't get a heart attack prematurely.
Yeah, it sounds like you folks really care about your patients, and that you deliver your services with compassion, which is a great thing. So it seems like they get a lot of value out of their dollar when they go to Brand Wellness for dental service. That's really good to hear. Now, I'd like to ask, how often should a patient be seen by a dentist for routine oral health?
That really depends on the person. Most people, twice a year is fine, but if you've got some, long-term standing problems where you find your gums are bleeding or you got little sensitivities here and there, certainly you should go more frequently if something's out of order. And if you have chronic things like gum disease or other issues or even things like bad breath, you probably want to go a little more frequently to get that under control, because, the health of your mouth is a reflection of the entire health of your entire body. So by getting your oral health under control, your physical body will certainly be healthier.
Oh, wow, that's great. Now, what are some of your approaches to periodontal disease and treatment?
We take a different path than conventional dentists might take. Most of the time in conventional dentistry, if you have gum disease or periodontal disease, they would suggest deep cleanings, which is good, or sometimes they even suggest surgery if the things are really out of control. We're not big believers in that. We try to do things to get the body to heal itself. So certainly doing things like flossing are important. That's a number one. If you're not flossing, you're doing a big disservice for your entire health. And brushing, on a regular basis. But there is other things you can do for gum disease at home in the convenience of your own home. Things like oil pulling, something as simple as that will help your gums improve. It'll also help your entire body improve because oil pulling has been around for centuries. It is an old Ayurvedic technique that pulls toxins out through the meridians of the mouth, through the teeth and the gums and the tongue. And when you oil pull, you're not just helping your teeth to heal, but you're helping your entire body to heal. And oil pulling, for anyone's not familiar with it, is a very simple thing to do in the sense that all you need is a tablespoon of a good quality organic oil. Conventionally, it was used with sesame oil, but in the dental field, we always recommend coconut oil because of its antiviral, antibacterial properties. So it helps reduce the bacteria and the bugs in your mouth. And also, coconut oil for the teeth is really very therapeutic because it actually has been shown to help the tooth enamel, which is the outside surface of the tooth, to remineralize. So if you have any little pitting in your teeth or sensitivity or even tiny cavities, you can actually reverse them with oil pulling. So it's a good habit to get into if you do it on a daily basis. It will certainly improve your overall oral health as well as your body health because you're also pulling out the toxins. And the other way oil pulling works is it also sublingually under the tongue, you will absorb the essential fatty acids that are in the oils. And, certainly the good oils like olive oil and coconut oil have a lot of good essential fatty acids. So by absorbing them directly sublingually into the bloodstream, you're bypassing the gastric juices, and therefore you don't have to worry about whether or not you will absorb it through the intestines because it's going right into the bloodstream. It's sort of like when people take homeopathic remedies and put it right under the tongue. It goes right in to the bloodstream, or even if they take a nitroglycerin tablet if they're having a heart attack, that goes right in, because you take it sublingually, and it's very effective very quickly. So people do oil pulling besides receiving their teeth getting, whiter and stronger and less sensitive. It also improves your gums because of all the antibacterial effects of it, but it will improve your entire body. I mean, I think one of the immediate things people see with oil pulling is things like their skin getting better because they're getting all these wonderful essential fatty acids coming into the body, helping their skin to heal. So, So the periodontal disease, I mean, you can do stuff at home, but if you're working with a holistic dentist, there are other things we do. In our office, we use lasers, which are really therapeutic. Conventional dentists probably don't use them for the gum disease. But the lasers are really great because they not only sterilize the periodontal pocketing that's underneath the gum where the bugs are living, it kills them off by sterilizing it. It also stimulates new connective tissue growth so that you can get reattachment of the gum. Yeah, it's amazing, this stuff. So you get reattachment of the gums, and the bone actually may start growing, going up a higher level if you've had bone loss. Now, it doesn't happen in a couple of weeks or a couple of months. It has to be done over time on a regular basis, and with that, you have to maintain extremely good oral home hygiene to help the lasers to be more effective. And the other thing we also recommend for periodontal disease, see, it's a pretty big topic you just approached right there. We could be here for days. But anywho, we also suggest using a magnetic irrigator. Basically, it's like a water pick, but it has magnets in it. And we have them in the office. We do dispense them to our periodontal patients, and they're really very effective because what the magnetic irrigators do is they create a charge on the tooth surface so that the teeth actually repel the plaque. So if you flossed and you brushed, but you may not have gotten everything because you weren't so careful or there's some deep pocketing, if you use this irrigator, which is like a water pick, but it has magnets in it, now you got a charge on your tooth, and the teeth will actually repel the plaque that's on there. And
wonderful.
Yeah, it's really very effective. We get good results with people who have gum challenges, trying to get this periodontal disease to turn around. And I think, the other thing, getting back to just whole body health is nutrition. You got to take a lot of antioxidants if you're going to get any inflammation to reduce itself, whether it's in the body or it's in the gums. So antioxidants like vitamin C or any of the brightly colored fruits and vegetables will help.
Yeah, blueberries.
The blueberries, you got it. And I think the other nutrient which is really great for gum disease is coenzyme Q10, or it's also called ubiquinol. So you can buy that in any health food store. I mean, there should not be any bad side effects from any of these unless you're taking like tremendous, massive doses. But within a reasonable amount, you should see good results all around, not just in terms of the gum disease, but your general health. And just sort of something else that might be important, because when you come to my office, we also take your saliva pH to check for acidity or alkalinity of your saliva, because that's sort of a reflection of how your general health is. And we find with a lot of people that have periodontal disease or even other health issues that that the pH of their saliva is very acidic. And when you have an acidic environment, you're going to have inflammation. And if you have inflammation, you're going to have pain. So it's really important to look at it from many aspects, because when you can get the pH of the saliva more neutral, usually about a 7.0, then the whole body's going to shift, and the gum disease will have a better chance at healing. There's no just one answer to fixing everything. There's a lot of ways to approach this. And, that's sort of the way I look at everything, is almost like it's a puzzle, because, my philosophy is that there's no disease caused by a deficiency of any drug or any surgery. So when you come from that philosophy, you got to figure out what happened to your body that you got out of balance, that you have to get back into balance. And most of the time, it's usually stress-related, or it's a poor diet, too much fast food with a lot of chemicals added to it. So we have to just be more conscious and aware, so that we can do the best we can to help ourselves to heal.
Yeah. Now the other question I had is, how has Obamacare affected your practice? Has it increased the number of patients that you see, or has it affected your practice at all?
I have not seen anything. I'm not even that familiar with Obamacare and dental, to be honest with you. So I could not really say about that. I know it's affected a lot of people with the medical health coverage, but not the dental health coverage. I know there is something involved, but we're not in that, because we are out of network for just about every insurance. And I think with the Obamacare, it's something that if you wanted to join as a dentist, you may have to have signed up to be part of it, and we are not involved with that at all.
Okay. Yeah. And what are some natural ways to battle bad breath? We've all experienced, walking past someone in our life, and they've got bad breath.
Yeah, I think the worst thing you can do for bad breath is use an alcoholic mouthwash. There's so many out there, and I won't mention names, because alcohol in general tends to make your mouth drier, and anything that makes your mouth drier will make the bad breath worse. So from that perspective, if you're going to use a mouthwash, certainly look for one that has no alcohol in it. On top of that, there are many aspects to bad breath, and it could be due to, just poor oral hygiene. You're not flossing and brushing enough. It could be accumulation of plaque and bacteria on your tongue, so you should always brush your tongue when you brush your teeth, or perhaps even do some tongue scraping. The other issue we find with bad breath, because we do a lot of bad breath treatment in the office, and we're really pretty successful at it. I'd say 99%, because we've really covered all the different bases of what can cause it. The other aspect of bad breath would be sinus issues. If you have like a postnasal drip or really congested sinuses, that's a major factor in that, all that stuff dripping down the back of your throat and the bacteria just sitting there and creating that smell. And, of course, the other issue is digestive issues, because a lot of people are walking around and they don't have regular bowel movements daily. I mean, in a normal, healthy person, they should be having at least one bowel movement a day, and probably more like 2 or 3. You should have one every time after you eat. But if you're backed up and constipated, you're going to find out that all those odors that are, or all that stuff that's in your digestive tract that's sitting there fermenting, if you will, is going to back up and yeah, fermenting, it's a nice word, will back up and give you a bad breath. And I think the other issue with breath issues in general is the medications. A lot of people are on medications today, probably more than ever before. And if you're taking any kind of medication, many of them, and I'd say a good majority of them, will cause you to be dehydrated. So if you're noticing that, you have to drink a lot more water to compensate for the dehydration that these medications are causing. And when you have a dry mouth, and when you do have that dry mouth, your breath is going to be worse. That's why when I was going to say if you chew gum, everything, your breath gets better because the saliva is flowing.
Oh, okay. Now, what are the benefits of being a mercury-free dental practice? I see that your dental practice is mercury-free.
Okay, well, mercury-free is that's a big topic. Are you familiar with the whole aspect of mercury toxicity in those silver mercury fillings that people have in their mouth?
Yeah, I heard years ago that it's unhealthy. They put poison in people's mouths to fill their cavities.
That's right. All right, so the thing to bear in mind is those pretty silver mercury fillings that you have in your mouth, they're called amalgams, they are about 50% mercury. And mercury is the second most toxic substance on the planet, right after plutonium, which is radioactive. And you certainly would not put plutonium in your mouth or in your teeth because it's highly toxic. And so why would you put the second most toxic substance on the earth in your teeth? So there are better choices, and the choices that we offer people are things that don't have heavy metals like mercury. And people are looking for that because you find with a lot of people that have neurological problems like multiple sclerosis or Alzheimer's or even autoimmune diseases like lupus or, I don't know, there's a whole bunch of them out there. These are all people that usually test for high heavy metals in their system. So they're trying to get a little control by removing one source of it because the mercury fillings that are in those teeth, they look stable, and the American Dental Association says they are stable, but if you go on YouTube, you'll find many videos that show how unstable they really are, and they show the fumes coming out from the mercury fillings every time you eat on them, every time you brush your teeth, every time you drink something like a hot liquid, because the heat will make the mercury fumes come out a little bit faster. So you want to just, if you have health issues and you're trying to find, better health for your life and your family, you want to get these things removed from your teeth and replace them with something that's less toxic. The only thing I should mention is when you do that, you want to go to a dentist who's aware of all the safety protocol that's necessary to remove that. You can't just go to a dentist and say, hey, I don't want these silver fillings in my mouth, let's just replace them, because they'll just drill them out and the aerosol will go everywhere and the pieces will go down your throat and you'll be breathing and inhaling and eating this stuff as they're drilled out. So you want some safety protection when that's done. So you need to go to a dentist who's aware of the implications of removing this stuff safely. And, certainly we do that, and if your listeners are interested, they can go to a website called IAOMT.org, which is the International Academy of Oral and Medicine Toxicology, and they have a list of all the dentists broken down by state, broken down by country, who practice safety protocol for the removal of these toxic mercury fillings. So that's why we're mercury-free. Yeah, we're mercury-free for that. And I've seen the effects when people get this stuff removed. I mean, within a very short period of time, and assuming they get them removed safely, and then they start detoxing their body with many different supportive techniques, which we can tell you about in the office. Within a period of a very short time, usually 3 to 6 months, a lot of their neurological symptoms go away. I've had patients who had the brain lesions from multiple sclerosis. They find it on the MRIs when they do the brain scans, and within a short period of time, these lesions disappear from the brain. So everything is fixable in the body once you figure out how to approach it to undo the damage of these toxins. I also want to just mention, I did write a book. I wrote 2 books, actually, on detoxing from the environmental toxins, and I also wrote a book including that, but also detoxing from the energetic aspects of the toxic stuff that's in your environment, whether it's people or other things. So I just wanted to mention quickly, those 2 books can be found on Amazon. The one book where you can detox from the physical aspects like the mercury, and simple techniques that you can do like the oil pulling and body brushing and stuff like that. It's in the one book called My Secrets to Regaining Health. And the other book, which talks about the physical as well as the energetic aspects of healing, is called Enlightened Indigo Child. And I did write that with my daughter, who's a highly sensitive person and a clear everything person. And, that book had to be written because there's lots of people out there with lots of high sensitivities who are picking up everything energetically and physically from other people, and they need to know that they can be well and that they can heal themselves. So these books are very important. And if you go to my website, thebrandwellnesscenter.com, there are links to the books if anyone's interested in that.
Yeah, looks like we have 3 minutes left. I just want to say this. Yeah, well, it was a half-hour show. Originally I wanted to do an hour show, but we were only able to fit in a half hour. It looks like we're going to pray about having you back on the show. We'd love to have you as a guest back on the show.
Oh, sure.
Because you're very, very knowledgeable and informative, and just you're a wealth of information. And I actually, I'm hosting the show, but I love and enjoy hearing you speak about all of these different topics that have to do with dental health, because there's a lot of people out there they just don't have the knowledge, and I'm thankful that you're here sharing it today. And I want you to just tell people again how they can get in touch with you to book an appointment, and just give yourself a good plug out there so people can get in touch with you.
Okay, the best way to contact us is through the website, thebrandwellnesscenter.com. If you can't find it, just put my name in, Idell Brand, and you'll go right to where I am, and that's the best way to contact me.
Okay, and again, I had some other questions that I wanted to ask you, but I'm not going to have time. But I think I am going to ask you one question because it's a question that I had. I wanted to know, what is digital computerized X-rays, just in brief?
Okay, yeah, they're taking X-rays, but we do use a computer system. The beauty of it is that there's no dip and dunk tanks. We're not poisoning up the world with all these solutions that have to be thrown in the garbage, but there's a 90% reduction in radiation when you get the computerized X-rays. Hopefully most dentists out there have them, and the pictures appear instantaneously on the screen of the computer, so you can see all the great details of what's going on. But it's the way to go if you want to avoid radiation and just get a better picture of your tooth.
Okay, we've got about 60 seconds left. We've got about 60 seconds left. I, again, want to thank you, Dr. Idell Brand, and I want to let people know that she's also a Reiki master, a hypnotherapist, nutritionalist, and, she incorporates this into her practice. So, I mean, there's many reasons that you can, go to her website, like she said, book an appointment, and again, I just want to thank her, and we hope to have her back on the show. It's been a delight speaking to you. You're very well versed, and you speak very well. Thank you again for this opportunity to have been able to interview you.
Well, thank you, Michael. It's been my pleasure. I look forward to speaking with you and your listeners again. Okay.
Well, thank you. And again, anybody that wants to listen to this, it's going to be on podcast. If you have any comments or anything like that, you can go to Spiritual Health on Facebook, and you can Facebook me. Again, my name's Michael Stigl. I want to thank you for listening to the show. And thank you, Dr. Brand.
You're welcome. All right, bye-bye.
Yep, bye-bye.